talk show hour, as we've been doing for the last couple of weeks, and we'll continue to do so as long as it's pertinent. And we appreciate all the guests we've had in the last weekend this week from Bonner General Health. And right now we go back to our good friend, Dr. Stacey Good. She's with the emergency department at Bonner General. Stacey, how are you?
I'm pretty good. How are you, Bob? We actually also have Ben here today, too.
Hi, Bob.
Oh, good. Hey, Ben, I didn't realize.
That's all right. Surprise.
We need to talk to your PR person.
That's all right. We'll get it squared away.
Yeah. So Ben and Stacey Good are with us. I've been taking all week. We've had people calling in with questions, and I appreciate you guys taking the time. The first one that we've had from a caller yesterday is we've all read so much about certain symptoms of this virus, but the symptoms seem to vary a lot from reported cases. How do you know when it's your time to call the doctor? Some people are having trouble breathing. Some people don't have trouble breathing, but they're still testing positive. There's a lot of confusion as far as the symptoms are concerned.
Yeah, that's an outstanding question. That's one of the things that makes this disease so sneaky is that it doesn't follow a real strict script. Most of the cases are presenting with cough and shortness of breath and sore throat, but not everybody has a fever. Not everybody necessarily has a sore throat, and we're seeing more and more reports of folks with gastrointestinal symptoms like nausea, vomiting, and diarrhea. So the safest thing is to, if you feel unwell, assume that you have it, and remember that the vast majority of people who do end up with this illness are going to do just fine. The time to call the doctor is when you are feeling so poorly that you're having true difficulty breathing, not just I'm not breathing as well as I normally do, or I can't, I'm a little out of breath when I walk up the stairs, but significant difficulty breathing to the point of air hunger would be time to call your doctor. Stacey?
Yeah, I would agree with that. And I think that clarifying one thing you hear on the news and stuff about, quote, lower respiratory symptoms versus upper respiratory symptoms. And initially they thought that this virus was taking on lower respiratory symptoms. So think of that as like kind of cutting kind of by your Adam's apple down. So lower respiratory is going to be more your lungs. That's your dry cough. That's going to be your shortness of breath. That's going to kind of be those symptoms. Upper respiratory, you think sinus congestion, sore throat, nasal drainage, even kind of headache type symptoms. But now we're seeing over 50% of the cases don't have fever, and one of the most common presenting symptoms is headache and sore throat that rapidly progresses to those kind of lower symptoms or lower respiratory symptoms. So I would echo what Ben said, and if you don't feel well and you just don't know, we have a hotline here in the hospital now that people can talk to a nurse, and the nurse is in close contact with whatever physician's on an ER, and if they feel that this patient needs to come to the ER or is kind of on the edge, they call us, and we either call the patient and talk to them, or just send the patient to the ER. So there's a lot of options as far as not just calling one physician, but also calling one of our hotline that has the COVID nurse on it.
Well, really good information. Great to know that there is a hotline specifically for the COVID, and if you have questions, because there's got to be a lot of the confusion when we talk about all these various symptoms. Some people have this, some people don't, but still testing positive. You just want to talk to somebody, and get some answers. So you can call a Bonner General Health hotline and information there.
And Bob, do you want that number for our community?
Absolutely.
It's 208-265-3323, and it's manned from 9 a.m. to 9 p.m. 7 days a week right now.
9 a.m. to 9 p.m. 7 days a week.
So that's a good question too. There's a lot of misconception, or there's a lot of debate about medications to take versus medications to avoid, and there isn't any good data on what to avoid or what to take. There are some studies pending. Especially there's some studies out, being started in New York City, but specifically to ibuprofen. There's no good evidence that shows that ibuprofen is more harmful or that is associated with worse outcomes in those affected with COVID-19. The same holds true, kind of another one of those rumors out there on the street or on the internet is you shouldn't be taking any ACE inhibitors. Those are high blood pressure medications like
or ARBs.
Yeah, or so like lisinopril or captopril or those types of medications. They are there's no good evidence, and in fact, the American College of Cardiology recommends that people who are currently taking ACE inhibitors or angiotensin receptor blockers, ARBs, should continue taking those medications even during this current pandemic. And then kind of the flip side of that is you hear a lot of people, from all different stratas of American society, talking about hydroxychloroquine and azithromycin, and they're referencing a tiny little study out of France that has just had not very many patients involved in it, and it was suggestive of maybe a possible benefit, but there are some bigger studies that are being started in New York City that are going to help us figure out whether or not those medications actually are beneficial for those folks who are infected with COVID. The problem is there's not a lot of hydroxychloroquine floating around in the country, and there are folks with real significant autoimmune diseases like bad rheumatoid arthritis or lupus that rely on hydroxychloroquine to manage their symptoms, and those folks aren't able to get their medications right now because there's been such a run on this sort of on those sorts of medications. So those folks are really struggling because others are concerned that think that there might be some benefit for taking it in COVID. So it's too early to jump on the bandwagon of saying avoid this, do take that. We just don't have any good data for it.
But Bob, let me just add to the ACE inhibitor. So where that came from is that everyone knows what the little coronavirus virus looks like and has those little spikes on them. So those little spikes, so those little spikes where they attach to the respiratory tract, they're attaching to the angiotensin converting enzyme 2 on the lungs. So there's some thought that because these antihypertensive medications also attach at that receptor site in the lungs, the GI tract, and the kidney, that it could essentially make the disease worse. And there's also some hypotheses and some data coming out that part of the reason that kids are not getting infected nearly as severely as adults is because kids don't express this receptor of the ACE2 receptors as frequently or abundantly, I should say, as adults. So that's where the ibuprofen is coming from. My perspective on it is do Tylenol first because we don't know. But if you feel terrible, then I don't necessarily think there's harm to take ibuprofen to help with fevers and symptoms. I would start with Tylenol, and if that doesn't cut it, then add other symptomatic medications.
Great information there, Dr. Goods. And it's good to know about the ibuprofen, also about your blood pressure medicine. There's a lot of us older people are on blood pressure medicine, so we'll continue to take that at this time. Guys, of course, as far as I know, even today, we're not hearing about positive cases confirmed here in our section in Sandpoint, Moderns Ferry area. Is that still true today?
Yeah, the latest numbers still show fewer than 10, but fewer than 10 cases in Kootenai County. None so far in Bonner and Boundary County. The Idaho Statesman down at Boise is reporting, as of this morning, 99 cases statewide. So it's kind of hard because it's like, depends on which website you look at. Some are updated more frequently than others, but anyway, that's what the Statesman's reporting. So as of yet, we still don't have any positives. All of the testing that we have done out of BGH so far has come back as negatives. We still have a handful. I would say, I don't know the exact number yet, but more than a dozen tests that we don't have resulted. And it is still taking at least 5 days to get results back from the state lab, or from any lab. Now we're looking at almost 10, like sometimes 9 days. We're waiting for results to come back. So even if somebody feels this overwhelming urgent desire to get tested, they're still going to wait almost a week and a half before the results are going to come back. So but we're still waiting for that first positive to pop up.
We were down to very few tests last week. We have jumped up to having well over 100 again, which is good. So we've been doing some at-risk curbside testing for people that are going home. Last week we could only test patients that were getting admitted to the hospital. So yes, we don't have any positives, but we've only done about like 200 tests in our county, and I know Boundary's done a handful themselves, and so we've done a lot on admissions, and then kind of the high risk, high symptomatic people that are going home and self-quarantining. So we're hoping to get some in-house testing in relatively soon, where we can run the test ourselves and get turnaround within a day. Our lab is working around the clock trying to get that set up, and we have orders out to every private company in the United States to get more tests and more medium for the tests in. So because we need to swab more, and we're doing everything we can as far as that goes here.
It's hard because we're a small fish in a big pond right now, and with New York and New Orleans and San Francisco and Washington, the Puget Sound area, they are at the steep edge of the curve as far as the crisis goes, and so we don't have we have to wait in line. And another thing to think about testing is now that, as Stacey said, we have more tests available now, and so we can afford to be a little bit more liberal with who gets tested and who doesn't. But even if somebody's primary care physician writes an order for a COVID test, and they come and that person comes to the emergency department requesting a COVID test, it is still going to be the emergency medicine physician who is on at that particular time who is going to make the decision about whether an individual meets the testing criteria that we have currently in place. And unfortunately, because the number of tests that we have will fluctuate from a day to day, from hour to hour and day to day, we're not going to, we can't push out to each of the primary docs.
Or even the community.
Yeah, and certainly not the community. It's like, okay, we're going to be testing these people with these risk factors today, because it could change at at the drop of a hat.
We would like to do that.
Yeah.
That's our goal.
Ideally, if wishes were fishes, we would test everybody in the community, but we can't do that yet. And honestly, we don't have a realistic prediction about when that would ever even be feasible. So we just beg for folks' patience when, like I said, even if their primary doc orders the test, please understand that we're shepherding our resources as much as we can to make sure that the individuals who absolutely need it are able to get what they need.
And it's meeting certain criteria, as you said, as opposed to someone's opinion of you don't need this or you do need it. But you must meet certain criteria, so there's no turning away because whatever social reason or what have you.
Yes.
Good to know. You mentioned New Orleans. This really didn't hit the news until yesterday about it becoming a major outbreak there. Then on the national news last night, they're showing pictures of Mardi Gras, the French Quarter, and how crowded it was. It could not have been worse timing for this pandemic to hit than to have that Mardi Gras celebration. It's unbelievable, the human contact right there. For me personally, it's kind of scary when you see that. We were talking last week, and a person phoned in last night saying that you guys were mentioning it's just a matter of time until we have a confirmed case here. You still feel that that's true?
Absolutely.
Yeah. And I'm even convinced that we have had cases already before we were even testing. Like, we've had patients in the ICU that were super sick, that were febrile and end up being intubated, and their x-rays didn't show an obvious pneumonia, and everyone's like, why are they sick? I can think of a handful since January that I admitted that fit that criteria, and we didn't, like, COVID wasn't on our radar. It was a Chinese thing at that time. So yeah, I'm convinced it's here. I wouldn't say otherwise if I didn't truly believe that.
Yeah, because you still hear, I still run into people here and there saying, oh, it's just the flu, everybody's going to be okay. Well, I think, most people are going to be okay, but it is very serious, and as you're saying there, Stacey, it's probably here, and we're doing everything we can to prevent it from passing along to everyone. We had someone call in yesterday saying that they've been sneezing and blowing their nose more than normal, especially first thing in the morning. Is this allergies or something to worry about?
If you have COVID and you're just sneezing, you're in great shape. So it could be COVID, it could be allergies, it could be the regular cold. Isn't there an old saying that if you sneeze, that means that somebody's thinking about you? Whatever it is, if it's just a sneeze, don't worry about it. Carry on, sneeze, just don't sneeze on anybody else. Sneeze into your elbow, sneeze into your handkerchief, whatever. Wash your hands afterwards. But if a sneeze is your biggest problem, you've got bigger fish to fry.
There you go. Another caller asked if it was first being reported this was primarily affecting older people, and it was just older people getting worse with the virus. We're wondering if their grade school kids are also at serious risk. I would have to think the answer is yes, because they wouldn't have closed the school, but doctors, what's your answer to that?
So there are no reported cases worldwide of children under the age of 9 dying. Ben and I have talked a lot, and we have 2 small boys, that this disease would be so much scarier. It already is, but if kids were affected more than they are. So yes, kids are getting it. Like I said, they seem to get the disease more mild. A lot of that is thought to these receptors in the lungs, but they can be vectors and carry this. And an article came out this week saying that people are shedding this virus for up to 37 days. And so our kids could very easily be the ones passing this on to other people. And that's one reason we're limiting our interaction that our boys have with one set of grandparents, and have very limited interaction with our the grandmother living locally, and that's the reason for that. So I think that's the bigger reason with schools being shut down, and we just don't know. And that scary part about this virus as well is, if you I won't get into the scientific microbiology of it, but when it went from animal to human, it mutated. When it had the ability to go from human to human, that's when it was able to spread. It mutated again, and then it mutated 2 different ways. So there's 2 different strains of this virus. There's an L strain and an S strain, and so this virus has an ability to mutate multiple times. It could easily mutate again and start affecting kids. So, like, let's protect our kids and keep them safe, and because we don't know what ability this virus has to continue to mutate and change.
And the other thing to think about is that, yes, primarily most of the individuals who are dying are elderly or and have significant comorbidities. First of all, that does not make them less worthy of continuing to live. They are an individual just like you and I are, and we need to protect them every bit as carefully as we protect everybody who's alive. And then secondly, just because young people aren't dying in New York or Italy or Spain or around the world from this disease at the same rate that elderly folks are, that doesn't mean that they aren't getting significantly sick. There are plenty of 30 and 40-year-olds who are intensive care units in New York City or in Italy right now, and so it's we can't just kind of set off the write this disease off as a disease of the elderly or the debilitated. Young healthy people get affected by this, and some of them get super sick.
Yeah, China, 60% of healthcare workers, they just reported, have gotten it and been seriously ill, and most of the healthcare workers are between the ages of 30 and 50, which is a little terrifying.
Bob, I don't know if you saw this, but it looks like Governor Little just put out a stay-at-home order for our state.
I just was handed that while you guys were talking there. Governor Brad Little just moments ago, statewide stay-at-home statement. For details on that, you can go to all the links to the chamber at the city of Sandpoint at Panhandle Health District and click on the COVID-19 update, and it'll give you in more details what Governor Brad Little's statewide stay-home order for Idaho. Guys, it's been really great having you on the show. We have about 3-4 more minutes. Just got another caller came in and asked if what if you just got back from vacationing in Mexico, how long should you self-quarantine, and should you just automatically do it at this point?
So the standard kind of quarantine length is 14 days. So self-quarantine, stay at home. Now that the governor's telling us to do it, makes it a little bit easier. 14 days is thought to be pretty much the upper limit of the incubation period for this. Most of the time it's about 5 days, but it does extend out to 14. And I think it's fair for everybody right now to treat themselves as though they have been exposed, and to limit contact outside of the home for those 14 days.
And let me add to that, if you get symptomatic, let's say this family came back 3 days from now, they start getting symptomatic, that's when that 14 days starts. Not 3 days ago and then it started on day 3, and now they're getting symptoms. And I just want to say that I think that I've been really proud of a lot of our community members. We've had a lot of calls in from people that have come back from Spain recently, from Seattle, from Mexico, and they just took it upon themselves that they're going to do their due diligence and quarantine. And I think that that's worth noting, that it's not easy, and I think that a lot of people here are doing what they need to do.
Dr. Stacey and Ben Good are with us from Bonner General Health. As we just mentioned, Governor Brad Little issuing a statewide stay home. Guys, we have a few minutes. We could expand on that a little bit. What does it mean when he says stay home? Can you go to the grocery store or?
So, I'm going to have to. I don't know. I haven't had an opportunity to sit down and read what the order says. Unless the order comes out and says something different, my suggestions would be take advantage of all of the local businesses that have set up curbside pickup of groceries, of meals. That allows the businesses to stay open. It allows them to continue to employ as many employees as possible while protecting themselves, and it limits exposure to potentially infected individuals. And you get to eat some tasty meals out of our fantastic restaurants and eat healthy food from our good grocery stores. But I don't think anybody's saying, lock your doors, put up a guard in front of, at the end of the driveway, and live off the land. We're not. That's not what we're at right now. Okay.
You can do that if you want.
I mean, yeah, this is Northern Idaho. You can do that if you want. And there are a lot of us who are prepared to do that. But still, like right now, this is still common sense, and hand sanitizer is going to be more important than stocking up on ammunition and camo clothing.
And I really think this is smart that they're doing this, and I really support it because we are 2 to 3 weeks behind the rest of the country. If you look at the map, like we were looking at the other day, we're not getting hit yet, but we will. And now's the time that we do the right thing so that when we do get hit, it's gonna not affect us nearly as bad as these big places.
I mean, when we chatted on Friday, Bob, how many cases did we have in Idaho? What was it, 42? So now it is, here it is Wednesday, and we're 2.5 times that at 99. So, it's accelerating. It's going to continue to accelerate. And the next time that we chat, we'll have a lot more cases in Idaho. There'll be more cases in
I'm chatting
Kootenai.
on Friday, so I hope we don't.
I mean,
Yeah, and with that, guys, we do have to run. Ben and Stacey Good from Bonner General Health, we appreciate your doctorly advice here today. We'll be back on with you guys on Friday with your schedule permitting. We have lots more questions, great information today, and keep up the good work. Thank you very much.
Thanks,
Thanks, Bob.